Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Dr. Amit Khanna. He's the medical director for the Sleep Center of Lawrence Memorial Hospital, and we are going to chat about sleep disorders today when we come back, so stay with us. Welcome back to For the Record. I'm Sean Murphy. My guest today is Dr. Amit Khanna. He is the medical director for the Sleep Center of Lawrence Memorial Hospital, and we're going to talk about sleep disorders today. First of all, it's your first time on the show, so welcome to the show.
Thank you.
Give us a brief and sort of a very generic definition of what sleep disorders are. There's obviously many, there are more than one, but in general, what are sleep disorders?
So that's a great question, actually, because people think of sleep disorders as a sleeping problem,
Right.
which it does not necessarily have to be. In some cases, it's a problem with wakefulness, and so we define sleep disorders really as either a problem with your sleep that's impacting your wakefulness, or a problem with wakefulness that you just can't maintain it. And usually the two sort of go hand in hand, but sometimes it's hard to delineate one versus the other, so we really have to dive into both aspects of.
Yeah, and really kind of diagnose it. Now, do sleep disorders in general get progressively worse to the point where someone may ignore it or just deal with it, but then there comes a point where they really have to address it in a medical way?
Definitely so. But to another degree, sometimes things can progress to a point where you've lived with a sleep disorder for so long, and you start to live in this sort of pathologic sleepy state, and you don't realize you're sleepy any longer. And it's not until we unveil what's actually been going on, treat what's been going on, that people just say, oh my goodness, I've forgotten what it felt like to feel rested. And they tell us all of a sudden they feel as if they're 10 years younger, they feel rejuvenated, as if they've been given their life back.
Yeah, that could be one of the biggest problems, is that, you know, people might not even think there is a problem, right?
That's very often the case. Many times we have patients dragged into the center by their spouse because of snoring, but
Right.
by far it stretches well beyond that.
Is that the number one reason why people will come in, because of snoring? It's like it's not a detrimental issue, but it's a really, sort of, I guess, a lifestyle, just annoying issue.
I think that's
disruptive issue.
It's definitely a big source of referrals to the center, but I think the biggest reason people come in is just they feel sleepy during the day. They can't maintain alertness that is impacting the quality of their life, either at work or at home or both.
So let's just start with you a little bit and your background and how you came to be at the position you are now.
So I began my training actually in family medicine at the University of Minnesota, and when doing so, I sort of realized that sleep disorders is somewhat of an evolving field of medicine, and I often had a lot of questions, and my superiors couldn't always teach me the answers that I was looking for, and so I sort of dove into it just out of special interest, really, more than anything else, and was fortunate to work with some of the world's foremost experts in sleep disorders, which led me to fellowship training. And coming from a family medicine background, it allowed me to do both pediatric and adult sleep disorders, because this is by far not just a problem of adults.
Yeah, we were talking about that off the air. We think of sleep disorders, we think of the typical person who, has a job or a life or a family or some reason in his life or her lifestyle that causes the sleep disorder. But pediatric sleep disorders are a real phenomenon. It exists. And people don't realize it. Talk about that a little bit.
Yeah, it's really true. I mean, the big difference is kids don't manifest sleep disorders the same way we do as adults. Adults, when we're sleepy, when we're tired, if something's going on, we'll let you know about it. We'll be like, get out of the way, I need to lay down, I need to sleep, I need my rest. With kids, it's complete opposite. They act ornery, irritable. Parents often wonder if they're having behavioral issues. Many kids, in fact, have been misdiagnosed with disorders such as ADHD.
Yeah.
And
that gets used for everything, it seems,
It's unfortunate that sometimes you could be misdiagnosed with something so significant because the treatments of ADHD aren't taken lightly, stimulant medications. And it's phenomenal when we can actually unveil a sleep disorder, treat a sleep disorder, that diagnosis of ADHD goes away, and when we improve a child's sleep, they're given their childhood back, and their grades improve, their relationships with their friends, their families, their siblings improves, and it's just such a rewarding aspect of what we do.
Now, don't kids usually have a lot more energy anyway? So, I mean, you would think that, first of all, burning all that energy would get them tired in the first place. But do they need as much sleep, or do they actually need more for healthy life?
Yeah, in fact, they need more. And if you're not getting sort of the requirements that you need, it actually will impact your health in a variety of ways. And studies have shown just in any age group, if you are sleep deprived, in a manner of speaking, your lifespan will be shorter than it would be otherwise.
Wow.
And kids' sleep requirements change as you get older until adult years. And even through adult sleep needs and requirements sort of evolve into different ways of sleep.
Now, with all the sleep disorders that there are, buzzwords like sleep apnea, the things that people know of just like through a lot of media attention and things like that. Let's just start talking about what is sleep apnea.
So sleep apnea, as you said, is getting a lot of attention, especially over the last decade. It's really becoming more on the radar screen for the public and medical professionals. I like to define sleep apnea. Well, it's defined simply as a cessation of airflow during sleep. But when I describe it to patients, I sort of use the analogy of a straw or a pipe. If you think of your airway like a straw or a pipe, when you're laying down and sleeping, it should stay open so you can get air through your nose or mouth down into your lungs. However, in sleep apnea, that pipe will close off, sort of your airway. And as it closes off, you don't get air down into your lungs. When you don't get air into your lungs, you don't get oxygen perfusing into the blood, which in turn causes a drop in your oxygen, which your brain senses before anything else, and it wakes up, whether you realize it or not. Many times, symptoms are not realized or minimized by patients. And so when their brain wakes up, it sends a message to the muscles in the neck to sort of tighten up and pull that airway back open. And this disrupts sleep quality throughout the night, impacts oxygenation throughout the night, which in turn leads to a variety of medical disorders that it can be related to.
Now, if you don't get oxygen to the brain, that's a real problem, isn't it?
Yeah, this is a significant risk factor for strokes.
Yeah. Now, when you talk about like the lungs closing up, the sort of the tube, what's the difference between that and basically asthma, which is doing the same thing with your lungs?
So asthma is more of a spasm and a hyperreactivity of the airway. And interestingly enough, people with that type of reaction could have a predisposition to sleep apnea, but it's not an independent risk factor by any means.
Now, snoring, can that be caused by sleep apnea? Because if it is closing up a little bit, won't that affect snoring or make it worse?
The two are definitely, there's a strong relationship between snoring and sleep apnea. I don't want everyone who snores out there to get alarmed, because 50% of the adult population will snore, but approximately 50% of those people are actually having closure of the airway during sleep that could be defined as sleep apnea.
Now, what are the other, we talked about sleep apnea, but what are the other, the big things as far as sleep disorders?
By far the largest of any sleep disorder is insomnia.
Okay.
And beyond that, another big thing that's evolving is restless leg syndrome.
What is that exactly?
Restless leg syndrome is actually, it's quite a simple diagnosis to make if you know what questions to ask. You don't need a medical test. A lot of people are turned off by some of the testing, but for restless legs, you don't even need to go through that. You just have to have 4 criteria, basically. Number 1, it's sort of an odd sensation in the extremities. And people describe that odd sensation in all sorts of ways. Creepy crawlies, pins and needles, jittery feelings. Some people call it their Elvis Presley legs. And then the second thing is that
Is it really your leg really get
well,
restless?
so the name is a bit of a misnomer.
Okay.
It doesn't have to just be the legs. It could be your arms, your back, your neck. It most commonly is the legs, and that's where the name does come from. So it's this odd sensation. It usually happens at bedtime, which can make it hard to get to sleep. But it could also happen during the day, during a long period of inactivity, such as a long car ride, a plane ride, a long bus ride, sitting through a movie. It really just drives you nuts. And when it happens, the 4th criteria is that you have this irresistible urge to want to move that part of the body, be it stretch it out, walk it off, massage it, pound it. Just, you got to do something with that affected part of the body.
Well, isn't that a natural thing? If somebody's foot falls asleep, you want to get up on it and get the circulation back going in there so that tingly feeling goes away, right?
Yeah, and this is similar to that in the sense of what you want to do, but it's not actually that that part of the body has fallen asleep or that it's sort of been impinged. It's sort of this phenomenon that you just feel.
Yeah. Now, insomnia, I think that word gets really thrown around a lot, and maybe people use it too much when maybe in fact it's, they'll use the word insomnia for any time that they can't fall asleep or go to sleep or stay asleep, and it gets used a lot.
Yeah, I mean, 2/3 of people experience insomnia at some point in their life, but usually it's very transient. To really have a diagnosis of some form of insomnia has to be lingering on for more than 3 months. And it really is defined as either having a problem falling asleep, a problem maintaining sleep, or awakening too early, or any combination of those three, and then it's impacting the quality of your day.
Right. Now, because sleep isn't simply close your eyes and go to sleep. There are stages of sleep, you know, the REM sleep that people talk about. Let's discuss that a little bit.
Yeah, so basically we cycle through different stages as we go throughout the night. A typical sleep cycle ranges from anywhere from 90 minutes to 120 minutes and involves 2 stages of light sleep, then there's deep sleep, and then there's REM sleep, as you mentioned, which stands for rapid eye movement sleep. That stage of sleep is commonly termed the dream state sleep,
right.
when in fact you can actually dream in any stage of sleep, but it's more consolidated during REM sleep than anything else.
Now, when you're a sleep specialist, do you need to delve into the, I guess, the realm of, you know, your subconscious in the sense of dreams? I mean, because they say that we need to dream to stay healthy too, right? I mean, it's sort of a psychological thing, I guess.
So we don't really do sort of the dream analysis per se, but what we do sort of evaluate is, are you going through those different stages of sleep? Because they're all important for our body in a physiologic way for so many different reasons, some of which we don't fully understand, some of which we do. What we know is you need to have them all in certain proportions to sort of live a healthy and productive life and enjoy sort of a certain quality of life. And sleep disorders of different types can impact those different stages, and different stages can be where certain disorders evolve out of.
Right. In your time in doing this, do you see advancement in the field of sleep disorders and treatment? I mean, we'll get into the specific treatments, but generally and overall, do you see progress being made in the right direction as we learn more every day?
Yeah, no question. I mean, so much has grown probably in the last 2 decades, probably in the last decade more so than at all. Technology has definitely been an asset in the field. And we've inherited so many patients that have been frustrated from, they just couldn't stand certain therapies that they were given in the past, and they just put this on the back burner, and then it sort of comes to fruition where they really need to address this. And as we discuss with them newer modalities to sort of address their concerns, people can also, or often achieve what they were looking for with some of the new advancements.
Let's take a break because we've got a lot more to get to. Why don't you give out the Sleep Center website, or if it's just the L&M website, we'll do that, and then we'll come back and talk more. So we'll actually put a graphic up on the screen and take a break. Amit Khanna, did I say that right?
Khanna,
the medical director of the Sleep Center, and interesting that the Sleep Center, its location, and some fun facts about that. So we'll take a break and come back. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. Dr. Amit Khanna, he is the, he's the medical director of the Sleep Center of Lawrence Memorial Hospital. However, it's not basically connected to the main campus, the main hospital. It's in a very unique location. So let's talk about that a little bit.
Yeah, I guess a few years ago, we did used to have the hospital sleep center in the hospital. And just realizing that sleep center is essentially, or sleep testing is essentially an outpatient test, we wanted to sort of make it in an environment that was more conducive to testing, an environment that was more comfortable, and that people would be a little bit more at ease with. And so what we did was we moved the sleep center to the Hilton Garden Inn in Groton, Connecticut.
So it's a hotel.
It's right in the hotel. We actually own a wing of the hotel, and in that wing, we have testing rooms as well as exam rooms. And basically, a patient will come in for a sleep study, if indicated, and get a room to themselves, which is just like any hotel room that they'd be used to. So really, we figure if you're not going to be sleeping in your bedroom, the next best thing is probably a hotel. Probably definitely better than a hospital bed. Probably better than even going to a relative's home.
So it's a regular hotel that regular people can use. It's just that there's a section that is unavailable to the general public because the Sleep Center has it for their specific purposes.
Yes, it's definitely private, but the rooms are very minimally modified from a regular hotel room. The patients will still get the same king-size beds. These beds have the ability to be adjusted as far as firmness to really match what your preferences are. Patients have control of the temperature of the room, the lighting in the room, and then they get to enjoy the amenities of just being in the hotel. Our patients can use the pool, the hot tub, the gym. We provide them with breakfast made to order in the morning. So there are some perks to this sort of atmosphere.
But not only, they are perks, but also I would imagine that makes it more conducive to what a typical day might be for them if they checked into the hotel, because you know, if you're in a sort of a lab rat environment, you might feel a little anxiety because of
No
that.
question.
But if you are just in your natural habitat, so to speak, you might be more inclined to be able to more easily participate in the study.
Very much. That was really the thought process behind this whole project, and it's really turned out to be great. And an interesting thing is some people come into the hotel environment and will sleep, and they compare it to taking your car to the mechanic. It's as if the problem goes away, and they just beside themselves. They say, I had this serious sleep problem, but I slept here, and things were fantastic. We still go through the motions and do all our testing, and sure enough, they may be right. There was no sleep disorder identified on the testing, but as we dive into things more closely and sort of tease out, there is a diagnosis of an environmental sleep disorder, and we realize that maybe something in the home environment is what's contributing to their sleep problems.
Yeah, you know, a lot of just regular life issues too. We talked off the air about people's, you know, day-to-day stress, maybe their job and things like that that cause the sleep disorders.
Yeah, no question. I mean, even simpler things is just your bed partner snoring and having a night away from that and getting a good night's sleep. You might realize it's just the noise level in your room.
Yep.
Or the lighting. You might be getting ambient light in the room from the outside.
What about the like the mattress and things of that sort? You know, there's rules about how often you should replace that, and you know how many pillows and things of that sort, right?
All sorts of things
Yeah.
like that, and we really sort of try to take all that into consideration and inquire about all those things to make sure people are sort of following what we call good sleep hygiene, which is sort of an umbrella term for just healthy sleep practices. And
What about people who claim to be light sleepers? You know, they can sleep, but the slightest little sound will wake them up, and then there's difficulty in falling back to sleep, and that, you know, interrupts what should be a normal sleep cycle.
there's definitely that phenomenon exists, and we see it more often than not. And in some cases, there is real pathology behind that. There is a sleep disorder that's preventing them from getting into those deeper stages of sleep. And for other people, it may be an offshoot of another issue, something that you alluded to earlier, such as anxiety.
Yeah, and that certainly is prevalent in the world today, regardless of
No question.
where you are. Now, the thing about you know, sleep disorders and the treating of them, unlike maybe a lot of other things where, you know, we'll test your blood, find out what's wrong, give you the appropriate medicine and fix it. But in the case of sleep disorders, before you can diagnose what the problem is, you just have to sort of study for a while the patient. So they have to be in that environment and they have to sleep, and you actually have to, that is your way of figuring out what the problem is. So they can't just come in and take a pill and then everything is fine. You have to allow them to try to sleep and actually be able to see what the problem is that way. So it seems like it's a long process.
I mean, it can be, but it doesn't necessarily have to be. I mean, we definitely try to avoid just doing Band-Aid therapy with a medication. It's easy to sort of cover up a
Right.
sleep issue with.
Right, you're not getting to the root cause of the problem.
Yes,
that way.
that's what we try to do. And we can do home sleep testing in a variety of ways that can tease out these things, in the sleep center type testing. And even just taking patients' sleep diaries and just getting a good history from a patient can often help elucidate a diagnosis.
So treatments today, you know, we were joking off the air, it's not just, you know, depending on what your problem is, sleep apnea or whatever, putting an oxygen mask over your face while you try to sleep. There are a lot of progressive and new ways to treat sleep disorders.
I mean, no question. With regards to sleep apnea, CPAP, which is that mask type device that people wear over their face, is definitely a turnoff for many. And there are a variety of other things that can be done to treat sleep apnea, and we specialize in sort of all those types of treatment modalities, some of which involve nasal type valves, which increases pressure in the airway to maintain an open airway that way. There are surgical interventions that can be done. There's also dental appliances that can be made for patients to do the same sort of thing. And really appropriately screening patients, not only just what they're looking for, but also what the nature of their disorder is. Medication advancements have been phenomenal in the last decade.
You know, we were, you know, and it also, I would imagine, can a person who maybe sleeps with a spouse or somebody else in the room, can they be not just supportive, but is there anything that they can do physically to be able to help the person who's having the sleep disorder differently in their lives?
I mean, no question. There's a lot of value when our patients come in with their bed partner, and the education process that we do for the patient definitely stretches over to the bed partner. Not only the bed partners are often a huge asset in helping maintain compliance in therapy and helping getting over some of the hurdles, because some of these therapies aren't simple. I mean,
Yeah.
you have to learn a new way to sleep essentially, and you've slept a certain way your whole life, and change is always difficult. And having
Yeah.
support helps in so many ways.
Now, we were talking earlier about depending on what your needs are, you might have to, even though you have the facility, sometimes someone may have to maybe go as far north as Brown University up in Providence, or maybe down to New Haven, Connecticut, depending on what's going on there.
Yeah, I mean, especially with pediatric testing, it's a rare entity to find a sleep center that does pediatric testing. Unfortunately, we provide those services for all kids ages 2 and above, and since building this new facility, kids no longer have to travel to Brown or New Haven or to Hartford. So that's been a nice little gift we've been able to give to the community.
So we were talking off the air about what my day job is. I also host a morning radio show, and one of my colleagues, you kind of had a very similar interview with him and tested him, and because of our lifestyle, and this is a big problem for a lot of people, and we were talking about like shifts, especially in this neck of the woods where there are casinos and military bases and EB and things of that sort. Shifts, it's a fact of life, and unfortunately it could be a negative effect on a person's sleep.
No question. Having to work shift work is a reality of the world we live in, and ideally most people would love to just work the 9 to 5 type of job, but if they can't, there are ways to sort of compensate for that. It's not natural for us to sleep during the night. There's a small subset of the population that is their normal body's rhythm, but for the majority that's not the case, and if they're forced to work outside of their normal rhythm, we have a lot of techniques and tricks and even medications to help them deal with that type of lifestyle so they can still maintain a normal lifestyle and maintain somewhat of normalcy to their sleep-wake schedule.
So at the very latest, I have to get up at 4 a.m., which means that if I actually wanted to get 8 hours of sleep, which I never do, I would have to go to bed at 8 o'clock. Now that's it's difficult in general, but even more so in the summer when it's just completely light out at 8 o'clock, and that's difficult. And I never get 8 hours.
Light
of sleep.
is a big part of how our bodies work with regards to our rhythms of sleep and wakefulness. And in people who have sort of schedules like yours, we have to limit the light exposure. Although we love it in this part, in the Northeast, we only get light half the year like this, and so we really like to take advantage of it. But if your lifestyle involves sort of shift work, we have to limit the light exposure in the evening hours, and we tell people when they leave work, they should be wearing sunglasses to limit, because what the light does, it stimulates receptors in the back of the eyes, which has a chemical effect in the brain, which promotes wakefulness, and it's promoting wakefulness in a person like you at a time when you're trying to go to bed.
Right.
And it's hard to fight those neurochemicals.
Especially since your lifestyle, for so many years beforehand was more what would be considered on the normal side, and then suddenly you're asking your body to not do necessarily a 180, but drastically change in that respect.
Very much so. And then on the flip side is oftentimes people that have shift work schedules on their days off, they always like to flip back to sort of the normal,
so that they can actually enjoy where
time
their
with their
friends
family
are.
and loved ones. Yeah. And so that flipping and back and forth from one schedule to another takes its toll on the body.
What is your opinion of over-the-counter sleep aids, just for the sake of being able to fall asleep? They just make you drowsy.
It's something, it's a real fine dance, and we suggest any medication used over the counter should still be done in consultation with your doctor. Just because it's over the counter does not mean it can't hurt you, and if it's labeled as herbal, it doesn't mean it's not necessarily going to be bad for you. And so things can be safe, but it should really be done in consultation. You can also hurt yourself. You can hurt your sleep schedule. You can make things worse.
I've found that using them, you may get a good night's sleep, but then for me, you're very drowsy because it's like still in your system or something, or it's like almost too powerful, and when you want to start the day.
Yeah, we call that the hangover effect, and certain medications linger in your system for longer than you may or may not like. Certain medications, if taken at the wrong time, can shift your sleep-wake schedule in different ways, sometimes to a later bedtime, sometimes to an earlier. So sometimes you may be using something to help you fall asleep, but you're actually pushing your sleep time or bedtime to later without realizing it.
I'm assuming that you as a doctor would encourage healthy lifestyle in other aspects just to help sleep, like for example getting plenty of exercise, and I'm sure the proper diet and things of that sort.
You're hitting the nail right on the head.
Yep.
Exercise alone I mean,
just makes you tired, you know,
well,
after.
not only that, I mean, it has so many health benefits that you're aware of, heart health, bone health, but studies have shown even just 20 minutes of exercise in the day will promote an easier ability to fall asleep, stay asleep, and awaken feeling more refreshed. And so the timing of exercise is also important. You want to not do any exercise too close to bedtime, as that could sometimes get you revved up and make it hard.
Yeah, if your adrenaline or your metabolism is cranking, that's a good thing for, you know, weight loss, but not necessarily a good thing if you want to fall asleep. And, you know, since the topic today is sleep disorders, that's in that one little aspect does actually help it. You know?
Yeah. The interesting thing you bring up about weight.
Weight is another issue about
Oh,
sleep.
it's a huge issue, but it's not. You can be as thin as an Olympic athlete and still have sleep disorders, but weight definitely is a risk factor for sleep disorders to evolve. And what we also know is if you're sleeping less than you should be, hormonal changes occur that will predispose you to weight gain. So just not getting enough sleep is a risk factor for gaining weight, and improving your sleep time can help you lose weight.
Yeah. Also, heavier people have more of a tendency to snore. I take it too, right?
Definitely the case.
Just because of the, I guess, I don't know, extra body fat or something, or just kind of
yeah,
constricts
increased
the.
fat mass, the effects that gravity has on that mass, less muscle tone as a result as well, and some of the hormonal related changes that go with increased fat as well.
Well, I hope people had an opportunity to learn something about sleep disorders and maybe about themselves, and I'm sure you would encourage them to, you know, if they think that there is a problem, to come in and get diagnosed. And
Definitely.
Because there's help, right, regardless of what
There
it
are.
is.
I mean, primary care physicians are trained in this type of thing, and when it's beyond their scope, there are sleep specialists who can take it to the next degree.
Dr. Amit Khanna, he's the medical director of the Sleep Center for L&M Hospital. Been a pleasure having you on the show today.
Thank you very much.
And thank you for joining us for another edition of For the Record. I'm Sean Murphy. We will see you next time. Take care.